So yes, Dr. Walker's here to talk to you about gait speed, and I'm going to go fast because gait speed is all about speed. All right, so things we know. Gait speed is useful as a vital sign, can provide good insight into someone's overall health status, and is highly predictive of morbidity and mortality. It takes minimal time, unlike the Freed frailty assessment we just heard about, or doing a full SPPB. I can actually tolerate doing it in clinic without dying of boredom, but it's not routinely assessed in HIV clinics. We know that people with HIV experience a decline in gait speed at an earlier age and a faster rate than people without HIV. And if we can detect it early, we can actually do something about it if we detect declines in gait speed as a signal of declines in physical function. In an effort to capture some real-world clinic data that we can use with our patients, we set out at University of Colorado to measure gait speed for all persons with HIV over the age of 50 who came into our HIV clinic during a 6-month study period. Mostly what we wanted to know is, can we capture this gait speed in a way that is acceptable and feasible to all of the staff working in the clinic without interrupting their workflows, without it seeming meaningless to them, with it seeming like an actionable thing that they could do. And so we checked in with them at 1, 3, and 6 months with surveys and staff interviews. Throughout the process, we wanted to describe adaptations that we were making to identify what contextual factors were impacting the adoption of gait speed assessments, because we also wanted to use this to try to expand gait speed into other specialty clinics throughout the health system, which I'll talk about at the end. We used a PRISM framework to guide our surveys. Quick note, this was funded by a Collaborate pilot grant from CU Department of Medicine, which was a really great opportunity to get people in geriatrics, HIV medicine, oncology, and physical medicine and rehab all working together on one small pilot project. So what do we do? First couple months were all set up. We presented proposals that we were going to measure gait speed at clinic staff meetings so everyone was aware of what we were doing. We set up one-to-one trainings with our medical assistants, who are going to be the people actually measuring gait speed during intake at clinic visits alongside the vitals. We set up our gait speed courses with tape on the floor. We did a 4-meter walk course. Got the stopwatches that we needed, and then met with each provider individually to make sure they knew what was going on and make sure that the gait speeds we were measuring that would be in the EMR would show up in their notes alongside the other vitals. So we had a little one-to-one IT help with each provider. And then we pilot tested with 2 providers, myself and Dr. Erlandson. Once we kind of got that up and running by months 3 through 6, our goal was to be assessing, again, every gait speed in every older adult with HIV over 50. One of the big expansion hurdles was that we had a lot of medical assistant turnover during this time, and so we were constantly retraining new staff members, as well as providing lots of reminders and visual cues for the trained medical assistants to help them remember to measure gait speed. They were used to doing blood pressure, heart rate, but not actually checking how fast patients were walking. When you enter the clinic, you can either turn left or right to go to the different clinic rooms. So we had to set up an additional measurement course to make it easier for them to catch patients that were going to the right. And one of the big hurdles we found that'll come up in the interviews is that they were having a hard time remembering, oh, who do we screen? We have some patients in this clinic that don't have HIV, people there for PrEP or vaccines. They were having a hard time keeping track, so we broadened in about month 4 to include gait speed measurement for anyone over 50 to try to just capture the people over 50 with HIV. And then I'll show you a picture of this in a second, but we initially did not set out to just use stopwatches. We wanted to use a very fancy Gait laser-based measurement device, but that was installed in month 6 after very long delays with infection prevention and the facility staff. So here's what that device looks like. This is from colleagues at Georgia Tech and had been piloted in our geriatrics clinic. It's very fun. You hit the little blue button, you have the patient walk along the wall past the little green sensors in the picture below, and it'll spit out the time it took them to walk the 4 meters and the time in meters, or the speed in meters per second on the screen at either end. It's bidirectional. And my anecdotal big success here is that within minutes of it being plugged in and on the wall, we had a fellow and an ID provider testing their gait speed and seeing how fast it could go. But very, very simple. You just push the blue button. You don't have to do anything else. How do we grease the wheels to motivate providers, medical assistants, and leadership? We did provide Amazon gift cards as a reward to medical assistants after they completed 50 assessments. So they had a carrot, little target to reach for. We had research assistants checking in periodically to provide coaching and troubleshooting. They would pop into clinic, see how things are going, watch a couple gait speeds get measured. We designated a medical assistant champion to motivate peers. We had one celebration with themed cookies from one of our providers. They look awesome. And then we highlighted the progress throughout division meetings and the division newsletter. This is what the gait speed looked like for providers in their notes. This would show up just below the vitals. They would get the 4-meter walk time. It would be highlighted in red if their 4-meter walk was less than 0.6 meters per second. And as we got subsequent readings, they would get a trend just below. So you could monitor changes from visit to visit. While we were mostly focused on just the act of measuring the gait speed and putting it in the EMR consistently, we didn't want to leave providers totally in the dust or patients, so we did have a patient handout that medical assistants or providers could give with a little more information on gait speed and tips about how to improve your walking speed. And we did have a flow chart for providers that was emailed and put in the rooms, advising them on what to do. I won't go through this entire pathway, but it essentially is trying to guide providers to send folks with slow gait speeds to either physical therapy, behavioral health, or community exercise resources, which were also printed out and put it in the rooms. So give them something to do, even though that was not the focus of the initial project. And here's what we saw. So over the 10-month period, we ended up going longer than 6, recorded 858 gait speed measures amongst 575 distinct patients. At the start, we were capturing about a quarter of eligible patients. By the last few months, we were hitting around 40 to 48% of eligible patients in any given month. So really struggling to pass that 50% mark, but still better than 0. The mean age of our patients captured were 61, if we just look at the folks over 50, with an average walk pace of 1.1 meters per second. For reference, the average gait speed in US adults over 65, so an older population, is about 0.9 meters per second. So this is about what we'd expect to see. And we did capture a lot of slow gait speeds with a minimum of 0.2 meters per second. And that's what we want to see. We want to see that we're hitting a roughly population average, but still capturing those folks at highest risk of functional decline. Again, we did staff interviews at months 1, 3, and 6, as well as feasibility and acceptability questionnaires for both staff and patients. Question 1 on the patient acceptability questionnaire was, have you talked with Walking Speed about your provider? And this is good to see that we're starting from a lot of no's. Those 5 yeses are probably my patients and Christine's. So starting from a good low baseline. When we asked patients what they thought about the progress, they were generally very in favor of it. I will highlight kind of the 2 most positive results. One was that having my walking speed measured takes a lot of effort on my part, a lot of strong disagreement. They did not find this hard. They thought it was very easy. They just had to walk down the hallway they would have walked down anyway to get to the clinic room. And then the most positive response on the other end was agreement with, I look forward to continue monitoring my walking speed at my appointments. There was a lot of excitement towards tracking this data point over time. When we asked providers about their views on acceptability and feasibility, I showed the acceptability scores here. Feasibility was quite high, both at pre and post. It seemed pretty easy to them, in part because they weren't actually the ones doing the measurement. They didn't have to do any extra work. But they did find the intervention quite acceptable. The sort of most negative results here were that the assessment is appealing to me, or that they like the assessment. We had a few people that did not find them appealing or did not particularly like them. But that was, we'll see in the interviews, partly that they did not know what to do with them. So here's the meat of what we wanted to get out of this pilot. This is the qualitative data from our PRISM-based surveys on acceptability. These are from providers, medical assistants, and staff clinic leadership. The big theme and the huge takeaway I want you to have is that measuring gait speed is easy. We all kind of thought, this is going to be hard, it's going to disrupt workflow, medical assistants won't like it, leadership won't like that it takes more time. That didn't come out at all. Everyone was like, oh yeah, piece of cake. This takes no effort on our parts. The patients have to walk into clinic anyway. We can measure how fast it's happening. Minimal impacts on workflow. We were hoping that that fancy laser device would make things easier and people would love it and be wowed by the high tech. One person said, oh yeah, this is cutting edge, but no one actually said that it was any easier than using a stopwatch. So you don't need a fancy laser device to measure people's gait speed. It's just kind of fun to have. And then the biggest barrier, as I mentioned, was that cognitive load. So medical assistants had no trouble doing the gait speed, but they had a lot of trouble just remembering who needed to have a gait speed measure. So keeping your target broad, like measuring it on all patients or all patients over 50 can help. And even though we did not give them a lot to work with on how to act on these gait speeds, all surveyed participants found a really high value potential. There were a lot of statements like, I see how this could be useful. I think this is really good. I really want to start acting on this, but there was a lot of uncertainty on how to actually apply the results with requests for more education on gait speed and clearer workflows for what to do with an abnormal value. 2 quick representative quotes to get at what I was talking about. So one provider said, I think this could be a parameter that would be kind of helpful or part of the story when we're trying to characterize our patients. And a medical assistant said, I think people get excited the more you know about it. We give them a little flyer and they can read about it and like, oh, how fast did I do? And we saw that a lot in our geriatrics clinic as well, is that the more you do it, the more patients get excited about it because they want to beat their last score. So next steps for gait speed measurement, we're going to continue troubleshooting to increase that capture rate, try to get more than half of our patients' gait speeds actually measured, continue to train new hires, and then big next step, include gait speed as an outcome in pragmatic trials of physical activity to see if we can improve it or see what interventions make the most difference for those with low gait speeds. And then again, a big purpose of this project was to just test out what it's like measuring gait speeds in specialty clinics, and it went well enough that we are rolling it out now in our geriatric oncology clinic. Thanks to the big team, again, representing multiple divisions at University of Colorado. It was a lot of fun to work with.
Yeah.